June marks National Alzheimer's and Brain Awareness Month, which provides an opportunity to reflect on the importance of brain health. There's some 6.7 million Americans over 65 that are suffering from dementia. Dr. George Grossberg is with us, and we want to talk about some of the early signs and maybe caregivers, what we can do with someone in our family. Doc, welcome to the show. You're telling me lots of folks are coming down with this as we age.
Yeah, thank you, Jack, for having me. Yes, and the number one risk factor for Alzheimer's disease is advanced age. So as the population is living longer and staying healthier longer, we're seeing more Alzheimer's disease. That's true.
Well, now, we want to mention agitation. That's part of it, but is that an early sign? Is that deep within a diagnosis where that begins, or what?
Yeah, no, I think agitation, we can see agitation even very early, but I think your question's a good one because we see an increase in agitation with the progression of Alzheimer's disease. So there may be some in the early stages, more in the middle stages, but even more in the more advanced stages of Alzheimer's disease, to the point where at least one in every two patients, at least 50% or more, are affected by clinically significant agitated behavior.
Well, I'm thinking perhaps doctors can diagnose Alzheimer's before agitation is there. That's what you've confirmed, I think. Tell me about this, caregivers.
Yes.
Are there things we need to know specifically to help those in our family with dementia?
Yeah, I think that's an important point. So one of the most important and vital things, I think, for family and for caregivers, care partners, is to make sure if you begin to see things like agitated or the spectrum of agitated behaviors or any significant behavior change, that you let the healthcare provider know about it. And then you can start to begin to develop a treatment plan. And the kinds of things we want the family to be looking for are things like, verbal agitated behaviors, like the person is now screaming or shouting or cursing, which they didn't do before, or physically agitated behaviors like aggressive pacing or agitated behaviors where the individual might be throwing things or threatening people or even overtly striking out. The healthcare provider needs to know that because sometimes they don't ask about it. Mm-hmm. And then we can work with the healthcare provider as family to develop a treatment approach.
I'm assuming a neurologist would be one of the first doctors you would see if you're thinking perhaps that's a diagnosis is needed. Tell me this, I'm thinking perhaps with Alzheimer's, the confusion itself that comes with that can lead to the agitation. So confusion may precede seeing that agitation symptom.
Exactly. Oh, that's a great point. So one of the things that we advise, and by the way, I'm a geriatric psychiatrist, and we deal with Alzheimer's disease and agitation in addition to other healthcare providers, primary care, neurology, and so on. But we can advise a lot of different things that can be done to minimize the confusion, simplifying the environment, having regular, meaningful, structured activities. But you're right, the underlying disease can trigger the agitated behavior as well.
That's very, very interesting. Is there a place we can go maybe online that we can get more information?
Yes, there's a great website I would recommend, and there's a lot more information, hands-on info as well. It's Managing Agitation in ALZ, all one word, Managing Agitation in ALZ.com for more information.
Well, we've got it up on the screen, our folks. We appreciate you with this valuable information. Dr. George Grossberg is in St. Louis. We appreciate you talking to us this morning, Doc.
Nice talking with you, Jack. Take care and be well.
You too.